You put a 2-year-old child in a crib with a bunny rabbit and an apple? Let me know when the child eats the bunny rabbit and plays with the apple.
Welcome to The Cannabis Vegan. I'm Jason Lawton. On today's show, we're really going to be diving a bit deeper into the 2016 Cannabis Health Summit, where we'll be hearing a bit from Amanda and the Drug Policy Alliance on cannabis as we see a little bit more for the future. This and more from The Cannabis Vegan.
But I notice you have clothes on, and I notice that you have a cell phone and you have a computer. It is unfair to pick one thing that lions do that you want to mimic when you don't want to mimic anything else they do. When lions walk up and greet each other, they sniff each other's ass. When I came in this room, you did not kneel down and sniff my ass.
That said, it's my great pleasure to announce our first speaker, Amanda Reiman.
Thank you so much. Good morning, everyone. It's an absolute pleasure for me to be here today, and I'm really glad that we're having this event. Here in California, we have a lot of opportunities to talk about cannabis, but for folks out there who maybe live in states where cannabis is still really heavily under prohibition, it can be really difficult to get good answers to some of these questions. So I'm really happy to have that opportunity. We've been talking about cannabis a lot as a medicine for various populations. And I think we can agree that for a lot of these populations, there's a lot of sympathy amongst the general public. For veterans with PTSD, for people with cancer, for children with epilepsy and autism. There aren't a lot of folks that say, you know what, if cannabis helps them, they should have access. But I'm here to talk about a different population. I'm here to talk about a population that doesn't garner a lot of sympathy with the general public. A population that we paternalize and tell what we expect of them in order to rejoin us as a society. And that population is those who have dependence on drugs and alcohol. We demand abstinence of these people, even though we know that doesn't work, and harm reduction programs, even though they're completely accepted and used in pretty much every country around the world. We still demand abstinence. We fight programs like syringe access and safe injection facilities. And we poo-poo substitution treatments as just trading one high for another. But unfortunately, our views of drug dependence in this country do not match what the science says. And it's based on fallacies about how people become dependent, if they become dependent, and what they need to move on with their lives. So today, I'm going to flip the script and talk about cannabis not as the typical gateway drug that we're used to hearing, but rather as an opportunity to exit potentially hazardous substance use. So I'm going to start off with this slide that was created by a hero of mine, Dr. David Nutt in the UK. It was published in The Lancet, and the reason that I bring it out is because there are two big fallacies about substance use that I think that this graph helps to break through. The first is that drugs are inherently either dangerous or safe, that there is no in-between. And as you can see from this list, every substance, even our beloved cannabis, has the potential for harm if it's not used properly. And even drugs that we say have no place in our society, like heroin and methamphetamine, aren't completely dangerous and do have some potential benefits. The second fallacy that is introduced in this graph is the idea that legality somehow is associated with whether a drug is dangerous or not. If you look at this list, you'll see the #1 drug on there is alcohol, completely legal in our country for those 21 and over. And the drug on this list that is supposed to have the least amount of harm, Psilocybin mushrooms, a Schedule 1 substance in our country. So I present this as a framework for the talk because I want us to stop thinking about drugs as good or bad. I want us to stop thinking about that good or bad being based on its legal status, and instead open our minds to think about substance use as a moving, living thing that changes throughout somebody's life. So is cannabis a gateway? You know, I grew up in the DARE generation. I remember This Is Your Brain on Drugs. And really the theory they presented to us about the gateway was that there was something about cannabis that when you started using it, eventually you weren't going to get that same kick and you were going to seek something more potent. And if you look back at the anti-drug films of the 1950s and 60s, you saw the same scene happen again and again. An innocent young white teenager is lured into an alley by a darker-skinned person and offered a marijuana cigarette. He takes it reluctantly. Switch to the next scene. The next week, he's shooting heroin. And this image was burned into the minds of a lot of Americans. And so they thought, well, cannabis must cause people to use harder substances. But let's think about this for a minute. Before most people try cannabis, they try alcohol. And before that, it's usually nicotine. Before that, they may dabble in some caffeine and coffee drinks. And then let's think all the way back to childhood, to the first substance we ingest that makes us feel really, really good. And that's sugar. So cannabis may be the first illicit substance that people try, but it is definitely not the first experience that we have with drug use. So instead, I'd like to posit this. Can cannabis help a person dependent on drugs or alcohol reduce their use or abstain from these substances? Now, of course, we've all been taught cannabis is a gateway, so the first thing we think is, oh, well, definitely not. It's just going to lead them down the road to harder drug use. But let's think about what we know about the science of cannabis. Well, we know it has a higher safety profile than most other substances. It's not going to lead to a fatal overdose, the same risk we have with opiates and alcohol. We know it presents a lower risk of dependence than most other substances that present a risk of dependence. And then something that's really fascinating. So when we talk to people about why they're unable to abstain or why they're unable to stay within their boundaries of substance use, they talk about withdrawal. And they talk about the horrendous withdrawal symptoms that wear them down until they use again. And let's think about some of those most common withdrawal symptoms. Difficulty sleeping, nausea, anxiety, muscle spasms, depressed mood. Now, I know I've heard of a medicine that's really effective at treating all of those symptoms, and it's cannabis. And the number of people who have told me that they've made it through their delirium tremens from alcohol dependence by using cannabis so they were able to sleep. I mean, this is not a joke. This is serious business. And I know that this is not a sympathetic population, but that shouldn't prevent us from giving them the best care. So I decided to do a study on this, and I'll just tell you just a really quick reason why. So I moved to Oakland in 2002. I became a medical cannabis patient of Dr. Frank Lucido, who has been working with medical cannabis patients in Berkeley for decades. He had a colleague back in the 1970s named Todd Micarea, who's a psychiatrist. And he spearheaded the study of people using cannabis to treat their alcoholism. He was doing this with his patients. So Dr. Lucido incorporated a question about whether patients were substituting into his intake form. After being his patient for several years and filling out that intake form, I was ready to do my doctoral dissertation at UC Berkeley. I decided to do it on how medical cannabis dispensaries operated as health service providers, and I asked Dr. Lucido if I could co-opt his intake form as part of my survey, and he said yes. And this is how it all started. I did my survey with 130 patients back in 2005. At the time, it was the largest sample of medical cannabis patients in existence, which tells you how far we've come. And what I found is that patients were actively substituting cannabis for alcohol, prescription drugs, or illicit substances. Now, as a scientist, when you see something interesting in a population, your first question is, okay, is this a fluke or am I really seeing something here? And the way you figure that out is you replicate your study. So that's what I did in 2009 with an additional 350 patients sampled from Berkeley Patients Group, a large dispensary in Berkeley, California. I gave them the same survey I'd given the original 130, and the results? 85% said that cannabis had less unwanted side effects than their other treatment. And 88% said that cannabis was making their symptoms much better. In terms of substitution rates, we saw 40% saying they were using cannabis as a substitute for alcohol, 26% as a substitute for illicit substances, and 66% as a substitute for prescription drugs. The most common reasons for this substitution were less adverse side effects from cannabis, better symptom management, and less withdrawal potential. So I said, okay, I think we've actually got something here. But knowing how controversial it would be to come out with this, I said, you know what? We need to be really, really sure that this isn't just a fluke, that this isn't just California, that this really exists. So we replicated it again in Canada with an additional 400 patients, and guess what? We found almost exactly the same thing. And so this really made us feel that this was real, that this was something that was actually happening in the population. And so then the next question becomes, how is it working? It's obviously working for these folks because you don't keep doing something if it's not working for you in some way, but we couldn't really think about why. And then I came up with a hypothesis, and it has to do with mindfulness. So in my years as both a cannabis consumer and being in the cannabis culture, something you hear again and again from people is that one of the benefits of their cannabis use is an increased level of mindfulness, meaning that they're more aware of how their body feels, of their surroundings, of how they're interacting with their surroundings, how that's affecting them. And so I was thinking, if staying within your boundaries of substance use is facilitated by having mindfulness, then maybe getting that mindfulness from cannabis is what's helping these folks reduce or substitute for hazardous substance use. So I thought, well, let's test it and let's see if this is the case. So I did another research study. This one was done at Spark, which is a dispensary in the Soma neighborhood of San Francisco. They've been open since 2010. And in addition to the cannabis, they offer a myriad of social and health services for their patients. One of those is a meditation class that's led by Jana Draka, who's a female Buddhist monk in San Francisco who does a lot of street outreach work. So we thought this would be a really perfect opportunity to see what is the interaction between cannabis, mindfulness, and substance use using meditation as a vehicle. So we recruited 8 people. It was a small study from a local harm reduction facility, and these were people that were medical cannabis consumers, but who were also trying to stay within their boundaries of methamphetamine use. And we had them fill out a standardized scale of mindfulness and of craving before and after each meditation session. We had them use cannabis, and we also had them keep a log of their drug and alcohol use during the 6 weeks of the study. Now, before I tell you about the results, I want to tell you something amazing that happened during the interview process. So if any of you have ever done qualitative research, one of the most fascinating things is when you take 7 separate people into a room and ask them a question, and they give you basically the same answer, even though they have not talked to each other, they have not interacted, and they have no idea what the other person's going to say. And that's something that happened during this study. So I asked them how cannabis helped them. How did it help them stay within their boundaries of their methamphetamine use? And this is basically what they all said. When I've been up for several days doing meth, and I know I should go to sleep, but there's this voice in my head that says, no, go buy more meth. It'll be really fun. Remember when we did that before and we had a great time? Go do that. But you know what? If I smoke a joint, that voice goes away, and I'm able to actually get some sleep. And you know what? When I wake up the next morning, I feel really good about myself because I was able to make a good choice. And that really nailed it for me. I mean, just the way they described the cannabis bringing them out of that compulsive desire to use this substance and let them take a step back, think about what they really wanted, and get some sleep so that the next day, not only do they feel empowered, but their level of self-determination, their belief that they can actually make good decisions for themselves increases. So there's a lot of benefit beyond just this psychoactive substitution for these individuals. So I'll also mention that after the 6 weeks, all of them had reductions in their craving, they had increases in their mindfulness, and they all reported that they gained tools during the meditation that they could use when they felt cravings for methamphetamine and they didn't want to use. So what are some of the implications of this research? Well, one, we talk about a gateway. If cannabis was truly a gateway, then these individuals would not be able to use cannabis every day throughout the study and still abstain from their drug of choice. Those participating in a harm reduction framework may be open to this because mindfulness helps them with management. And a big part of harm reduction is helping people manage their drug use to reduce the harms that they may have associated with it. Mindfulness absolutely may be facilitated through the use of cannabis, and cannabis may have the ability to quiet the addictive voice and help drug consumers stay within their boundaries of use. Now again, this is assuming that we're ready to embrace a harm reduction paradigm, which unfortunately we are not. We still look at what treatment programs get funded by the federal government. They're abstinence only. When we look at the demands of drug courts, they're abstinence only. But we know that under an abstinence-only paradigm, the failure rate is 4 out of 5. People are dying from drug overdoses, and yet we still are resistant to anything but an abstinence-based paradigm. So what are some of the barriers here? Well, as has been mentioned many times before, the Schedule I status of cannabis. So the fact that it has no accepted medical value at the federal level means that no treatment program that's getting federal money could use cannabis in part of their treatment protocol because there's no accepted medical use according to the federal government. Underlying this, we have the mission of the National Institute on Drug Abuse itself. So I don't know if this was mentioned yesterday. People ask me all the time, well, why don't we just go do this research somewhere else? You know, why don't we just have Germany do it or Spain do it? The United States funds about 80% of the world's drug research. We do. And all of that research falls within the mission of the National Institute on Drug Abuse, which is to study the dangers associated with illicit substances and to prevent the public from using them or desiring them. Nowhere in that mission does it say, oh, and see if we made a mistake about which drugs should be illegal because some of them are really beneficial. Like, that's not in the mission, and that really has disrupted which research studies get funded. There are legal barriers. So I mentioned drug courts. So right now, upwards of 60% of people who are in treatment for cannabis dependence are funneled there through drug court. So we have a population of people that are cannabis dependent that really just got caught with cannabis. In the meantime, we have people that have serious dependence on alcohol and opiates who can't get beds because they're not willing to be completely abstinent. So we're pushing people who have potentially life-threatening dependence issues out into the street, where we invite some young person of color who got caught smoking a joint behind a school to take their bed, and that's just not right. I mean, it would be one thing if preventing people from using cannabis as a substitute was just prolonging treatment or not making it as effective. But people are dying because we're demanding that they be abstinent from a substance and they're refusing to cooperate, and we figure that our indignant morality is more important than their life. And it shouldn't be that way. There's collateral sanctions for cannabis offenses. So if you're in a state, you have an addiction to opiates, you want to use cannabis instead, and you get caught, and you're not in a medical cannabis state, and you're in a state that's heavily under prohibition, you risk losing your job, your house, your children, your professional licensure, all of that simply for using cannabis to prevent or disrupt hazardous use of another substance. And then, of course, even in states that have medical cannabis, most of them have finite lists of conditions for which you can use medical cannabis, and they don't include addiction. Save for the states that have open-ended lists of conditions, it's very difficult for somebody to use cannabis specifically for drug dependence. They have to use it for chronic pain or some condition that they are maybe getting prescribed a drug that they want to substitute cannabis for. But just the simple act of having drug or alcohol dependence is not enough to warrant a recommendation in most places. And then, as I mentioned, treatment is abstinence only. That is pervasive. And there's some really great documentaries that have come out recently that really expose the private treatment industry. And I would encourage folks out there to take a look at it, because anytime you introduce profit alongside with healthcare, let me tell you, it becomes a business to make sure your bed is full with easily treatable people, which are those marijuana people that are coming through the drug court. And finally, the role of the criminal justice system in probation and parole violations. So if you're on probation or parole and you're trying to use cannabis as a substitute and you get caught, that can yank your parole or probation. So it's very dangerous for people in some places in this country to utilize what seems to be an extremely effective and promising tool to keep people from having problems associated with drug and alcohol use. So in conclusion, cannabis has a lower risk of dependence than most other substances, but no drug is completely safe or completely harmful, and the legal status has little, if nothing, to do with whether a drug is dangerous or whether it's safe. Most people who use cannabis and stop do so without formal treatment. So this idea that we need to funnel people from drug court into cannabis treatment is silly. You know, I ask people a lot, how many of you have ever were cigarette smokers? How many of you went to formal treatment to stop smoking cigarettes? Very few, if any, people actually enter into formal treatment, but nicotine is way more addictive than cannabis. So again, we're caught up with that what is legal, what isn't. Research suggests that individuals are already consciously substituting cannabis. So this is something we're seeing happen in the population, and that cannabis may actually be an effective tool used in treatment to help people stop or step down off of other substances, but it requires us to embrace a harm reduction framework. It's possible that in addition to that psychoactive substitution, cannabis may facilitate mindfulness, which also can help with behavior change. And even though we see all this promise and we get excited, so many research and legal and treatment barriers still exist to fully realizing this. Now, I will leave you with some hope. I have been approached in the past year or so by several very progressive treatment providers. And they're saying, you know what? Screw this. We know it works. We're tired of seeing our clients overdose on other substances. We want to open a treatment center that primarily utilizes cannabis in the treatment protocol. So I'm very excited about this. I think the more research and information we can generate, and especially compare this method to what we're doing now with this abstinence only and see which is more successful at keeping people alive and productive, then maybe we will start to see a paradigm shift. And we will start to see the more studied, the more evidence-based harm reduction take the place of this very draconian idea that abstinence is the only way. So this is my email. It's Reiman@drugpolicy.org. I'm more than happy to answer questions, and I'm more than happy to take questions from folks via email about this subject. And thank you very much for having me.
Imagine a world we could live in, planting seeds in the minds of our children. And these trees and grow our solution. Hemp can heal the world. Imagine a world we could live in, planting seeds in the minds of our children. And these trees and grow our solution. Hemp can save the world.
But remember, it took 400 years to convince white people in America not to own black people. You can see why this is taking so long. We can't even treat each other with kindness, let alone treat the chickens and the pigs and the turkeys and the insects of the world with kindness.
you're.
But I notice you have clothes on, and I notice that you have a cell phone, you have a computer. It is unfair to pick one thing that lions do that you want to mimic, when you don't want to mimic anything else they do. When lions walk up and greet each other, they sniff each other's ass. When I came in this room, you did not kneel down and sniff my ass.